We're back with part 2 of our special segment on strokes and stroke awareness. This time I have sharing the stage with me, Lori Gorecki. She's a speech pathologist with Advocate South Suburban Hospital. Welcome, Lori. Great to have you.
Thank you so much for having me here today.
Thank you for joining us. And we also have a very familiar face joining us today, and we get to show another side of our First Lady, the First Lady of Hazel Crest, Mrs. Dianne Alsberry, who is a physical therapist, and that is why she's joining us today. Thank you, First Lady.
Thank you for having me.
Thank you for having me.
Village of Hazel Crest.
Wonderful, wonderful. Well, I'd like to continue our discussion on stroke awareness so that, you know, people can get another side of it. Now, Lori, you're a speech pathologist with South Suburban, and I'm assuming have been for a while, and you can talk about that in a little bit. But tell us, what are the types of difficulties one might have after having a stroke as it relates to speech? Talk about that a little bit.
Sure. So someone with a stroke may experience a weakness on one side of the body, the left or the right side, depending on what side of the brain is affected. If the right side of the brain is affected, the left side would be weaker, and vice versa.
Gotcha.
In terms of speech, we would see someone maybe who has difficulty speaking. You might notice a facial droop, drooling, difficulty getting the words out, difficulty understanding the person.
Gotcha.
Sometimes people don't think about this, but difficulty in memory. Again, if that right side of the brain is affected, many times people can't even remember their names.
Gotcha.
Remember what day it is, orientation, things such as that.
Okay.
Another issue that people experience is swallowing difficulty.
Okay.
The muscles that control swallowing are affected by our brain. Okay? Our brain controls everything we do. So patients I see a lot are having difficulty swallowing.
Okay, okay. Well, you know, kind of just going off of that, what is the speech pathologist's role in rehab for a stroke patient?
Sure. So as a speech pathologist, I deal daily at South Suburban Hospital with stroke patients. I help people, again, regain their ability to talk, to remember words, language, swallow. My goal is to avoid having them go on tube feedings, which is a stomach tube, because they're unable to swallow due to a stroke. I work on helping people recall family names, letters, numbers. I have a story I can tell you of a patient that I have known now for over 10 years because he also comes to our stroke support group.
Okay.
This is a 57-year-old truck driver who had a stroke driving in his truck during work. He noticed something was wrong, so he was able to call his daughter and was able to say just enough to say something's not right. And his daughter was able to call the 911, the paramedics, and they were able to guide him over to the side of the road and meet him there and get him to South Suburban Hospital.
Wow.
At that point, I was able to see him at the bedside, and he said to me, "I don't need speech, I'm talking." And I said, "Okay, that's fine. Can you please write your name?" He looks at me with a blank stare, like, "Of course I can write my name." Picks up the pencil and is unable to write. Unable to recognize the letters, cannot remember letters, cannot remember numbers. So that is something that people aren't a lot of times aware of. So it's not just the speech or the language, but it's the cognitive ability, the reading, things such as that.
That is incredible, because the first thing you think about, if he's talking to you, if he's able to form or formulate words, then he should be able to write those words down, but that's amazing.
So he didn't even realize it at the time that he couldn't do it. So now, you know, how many years later, he's driving, he's coming to stroke support group, he's actually an advocate for our stroke support group, like Rob, educating people throughout the community, knowing the signs and symptoms of stroke, and also showing that I can get better with time and therapy and self-motivation and family support.
Okay, I was going to touch on family support, because you talked about being able to recognize family members, being able to, you know, write your own name again. So that takes support. That takes support from the family. How do you do that? How do you engage?
A lot of education, a lot of motivation. A lot of times I have my patients' families attend outpatient with them. So again, I see patients from day one in the hospital. They're only with us for a short period of time. At that point, we recommend that they go elsewhere, either to an acute rehab setting or a skilled nursing facility, a place that would accommodate their needs based on their deficits. When I mean acute care, that's somewhere such as Advocate Crest, where someone would go 3 or 4 hours of intense therapy a day. Many times our elderly patients can't handle 3 or 4 hours. It's just too much for them. So we would recommend a subacute. So still really good therapy, but just lesser hours, such as a Manor Care in Homewood down the street. Somewhere where they could also get subacute therapy and get, back to their basic needs and wants. Many times after that, they still need more therapy, and I would see him as an outpatient. And someone like my patient who I'm referring to, he had come to me for 11 months. And his daughters were initially driving him. The truck driver, who no longer could drive, was able to drive himself by the end. Yes.
Wow. So you met him at his bedside, obviously, in the story that you just told. Thinking about that, how soon after a stroke should someone see a speech pathologist?
As soon as possible. So again, in the hospital setting, our goal is to see patients within the first 12 to 24 hours at the very most. Again, our first priority is safety with swallowing. So my job is to make sure that the patient is swallowing safely. Again, the brain controls everything that we do, including swallowing. I have many times patients say to me, well, I can just drink water. Well, guess what? Water is one of the hardest things to drink because it goes back so fast. It's a liquid that's easy to choke on, and we take that for granted. So again, we see patients immediately right when they're admitted to the hospital and then throughout their hospital stay.
Wow, great information, great. I'd like to transition right now. We talked about speech and you just talked about even that correlation to cognitive ability and also the physicality of it. So we're going to transition to Mrs. Alsberry, who is a certified physical therapist. Now tell us from a physical therapist perspective, what does it entail in terms of rehabilitation to try to get that stroke victim back on track?
Well, we initially see the stroke victim usually at the bedside in the hospital, and we want to make sure that their blood pressure is stable before we start to treat them, and then we will test their ability to move. If they have paralysis on left or right, we do that testing. We then look at their ability to be able to move in bed. Can they roll? Can they sit up? Then we transition them. Can we then get them from out of bed into a wheelchair? So can they move from a bed to a wheelchair? And then we're going to look at their ability to actually walk. And so we will use different tools. It may be a walker, it may be a cane, but that way we know that we want to try and get that patient moving as soon as possible.
Gotcha.
Yes.
So now if you have a patient then that is in bed and is not able to roll over or sit up, is there a progression in terms of that treatment or therapy that will hopefully get that person to the point where they're sitting in a wheelchair?
Most definitely.
Okay.
But it depends on the deficits that they have.
Gotcha.
And that is what our treatment consists of, that mobility, that ability to roll, that ability to regain their balance. They have to have that sitting balance before we can even transition them to actually standing and walking. So yes, they definitely have to be able to roll and sit up in bed.
Okay, wonderful. Can you share with us maybe some or recent story of a stroke victim specifically that maybe you worked with from the beginning to some sort of wonderful progression? Or
I've worked in many settings. In the hospital, I've actually worked in the rehab center where there's intensive rehab, and in an acute skilled nursing facility where you have the elderly patient. So I've worked in that, but presently I'm working in home health. So after the patient comes home, they then have to be able to function in their home. So my role is to go in, to evaluate them, see what their deficits are, and then get them so that they can get their basic needs met, get to the bathroom, get in and out of bed, be able to get to the table so that they can eat their meals, and then be able to walk. And then if they have stairs, then be able to teach them how to go up and down stairs too as well. Because then they're going to have doctor's appointments that they're going to have to go to. So we have to make sure that they're as mobile as possible.
Okay. Now I know you did mention this, so please forgive me because it might seem kind of redundant. But how soon after a stroke should they begin physical therapy?
Are you talking about in the hospital setting?
In the hospital setting,
when
yes,
that blood pressure is stable, we usually can come in and start working with them.
So is that within like maybe 24 hours or 48 hours?
Yes,
or
most times.
And that depends on how severe that stroke may have been.
That is so true.
Okay.
Yes.
Speaking of severity of strokes, are there like labels for the different types of, is it mild, is it, I mean?
There is, yes. You can have a very minimal impairment all the way to a severe impairment.
Okay.
So it really depends on the type of stroke and the size of the stroke, what part of the brain the stroke occurs. So again, people are all different. I treat every patient. I never know the deficits I'm going to see until I really see that patient. And everyone has their own unique deficits that we work to improve upon. And again, as a therapist, we really work on meeting those patient goals. So we may have our own goals. I might come in and say, I think you need to do this, this, and this. And Mr. Smith may say, I don't care about this. This, I want to drive, or I want to drink my coffee again. So again, we really want to meet the patient's needs and address those personal goals.
Okay. So now, could a severity of a stroke be related or correlated with response time? You know, just like he was saying, he wanted to just get Robert was saying he wanted to just get his daughter to the hospital because that's the plans for the day. So even if, let's say he was able to walk when he took that step and he just put it off, could that stroke have gotten worse or?
Well, time is always very important, right? So as soon as we recognize those signs and symptoms of the stroke, remember the fast, we need to call 911.
Absolutely.
Because the sooner you can get to the hospital, yes, that could definitely help that patient and hopefully improve upon the likelihood that they will have less deficits.
Okay, okay. So now do you work with patients for long term? I mean, Ms. Alsberry, I mean, how long, I guess maybe has been your longest patient, I guess, maybe for lack of a better question?
Well, that depends on the patient. So if they're in an acute rehab center, as long as they're continuing to make progress and they're gaining function, they usually keep them there. And it can average for about a month, I would think, is about the average. Then after that, they're going to then transition them to the home. And a lot of times that rehab staff will actually come out to the home to do an evaluation. But if not, home health comes in. And we do that evaluation to get them moving. And that can be 3 to 4 weeks for getting them to, you know, the level they should be. And then they can transition to outpatient physical therapy after that.
So now what's your take on, because you've had the whole gamut from the beginning in the hospital, acute, and now home health. So what would you say is, I mean, I guess I shouldn't put it this way because you're dedicated, you're a PT, and I understand that. But what is your preference, in the beginning or home health right now?
I prefer home health. I prefer home because once that patient gets home, they're in their environment, and you got to work within their environment. In the hospital, they have a set routine. They eat at a certain time. They have to go for a blood test at a certain time. So they're in the hospital's routine. But then when they get home, their appetite increases. They're in familiar surroundings. Their family is there that's loving to them. And so you know, the home, I think they do much better.
Wonderful. So even though they're at home, I guess this is probably not a good question, but how do you get the family involved even when they go back home? As a PT?
Well, first I develop a home program for the patient to follow, and that could be doing exercises that they have to follow. It may be sitting on the side of the bed for so many times. If they're walking, that they walk maybe every 2 hours. So the family then has to assist them because they're not able to do it independently. If they did, I wouldn't be there. So we get the family involved by establishing a home program that they follow and that they can actually, you know, help the patient with.
Wonderful.
Yes.
Anything that you two ladies would like to add before we close out this wonderful segment?
Well, I would like to say one thing. One thing that I hear quite a bit from my patients and their families is, my dad forgot how to talk, or my dad forgot how to swallow, and that's really not true. So again, kind of going back to my role as a speech pathologist, I like to tell my patients and their families is that you didn't forget how to do those things. And it's our job as the therapist and the patient and your loved one to work together to find the new pathways to get at that information that is somehow lost because of that stroke. Imagine every day we drive to work, we take the same road every day, right? Well, every day you go to the same road, but all of a sudden one day there is a detour and the exit that you always take to go home. So imagine that as your stroke.
Gotcha.
There's a cut in the road, there's a detour in the road. So it's our time, our way to figure out a way,
find the way
to
back.
Find a new path,
Absolutely.
a new road to get to that information that is lost.
That's a good analogy. Okay, wonderful. Ms. Alsberry, anything you'd like to share?
Well, I just like to say that if you've had a stroke, that motivation is the key. And if you really, really want to get better, it will happen. But you have to work at getting better. And so I just say to my patients, you can do it. And so now it's time for you to keep moving.
Wonderful. Thank you, ladies, for your love and dedication to your professions. Thank you for what you do, because you are much needed, and I'm sure that all of your patients feel the same way. Thank you for joining me today, Mrs. Alsberry. Thank you for coming.
You're
it's
welcome.
wonderful that the people of Hazel Crest can see the professional side. Thank you so much.
Okay.
Thank you, Lori Gorecki, for what you do at Advocate South Suburban. Please forgive me. Thank you for coming on board, and I'd like to say thank you once again to Joyce Fitzpatrick and also Robert Clayton. Thank you so much for joining us, and hopefully we'll get a chance to come back and maybe see a little bit how Robert's progressing as he moves along. You know, Joyce, I'd like to go back to you and ask the question, are strokes preventable?
Yes, absolutely. So I think people are surprised when they find out that 80% of strokes are actually preventable. So I know there's things that when we think about stroke, we think about, well, age might be related to having a stroke, because after the age of 55, we double our risk every 10 years of having a stroke. So I like to always try to help people understand, sure, there's things we can't change, like age and our family history and genetics, but there are things that we have absolute control over.
Wonderful.
That we can change to prevent stroke. And I'd like to just hit the major
Please do.
issues. And Rob really touched on an important thing. As a stroke coordinator, I see over and over again, blood pressure control. So the #1 cause of both a blockage stroke as well as the bleeding stroke is hypertension or high blood pressure. And unfortunately, I see many, younger folks with kids coming in, and for whatever reason, the blood pressure medicine was just either kind of forgotten about for a while or run out, and we're all busy and have so much going on, but you really have to take that blood pressure medicine every day, really until the rest of your life, unless your primary care provider says otherwise, or you negotiate or figure out something different. A lot of time I see people trying to get things online for their blood pressure. They want to go like a natural route. And what I would always say is, if you buy something natural over the internet, or even in the different drugstores now, they have all these different supplements. You want to check with your pharmacist to make sure that the medicine you're taking doesn't have an interaction with these supplements. The other time is I see a lot of people waste a lot of really good money on supplements that really don't control blood pressure. And so I have people coming in with stroke, and they put away their prescription medicine only to try something that they read about online. And then they're saying, I guess this didn't work. So that's just an important thing that I see, that I would say you have to stay on your blood pressure medicine. Other important things would be to prevent a stroke is to control, if you have diabetes, control that blood sugar. Smoking cessation, you know, stop smoking. And I know that's easier said than done, but even if you try to stop once, try again. Keep trying. Don't give up. The other things related to stroke, a risk for stroke then would be high cholesterol, foods that are, you know, all that
diet
stuff.
Absolutely.
High in saturated fats. Other things would be physical inactivity. So what I try to tell people is just try to move every day. And if you can move 30 minutes, it doesn't have to be all at once every day, that will help. I know that we live in an area where it's a lot of times too cold and too hot, right? And people can't be outside. So I say become a mall walker or one of these big stores, Walmart, Menards, and just walk around that and just try to do something every day. Other things would be things like obesity, a heart condition called atrial fibrillation that contributes to stroke, sickle cell disease, and something called sleep apnea, where people snore and stop breathing when they're sleeping. That recently research has found is a direct correlation to having a stroke.
Wow.
And so if you know, were told that you stop breathing when you're sleeping and you were supposed to wear one of these machines that helps the oxygen get into the lungs, really important to continue that. I do see a lot of people coming in with that sleep apnea where they stop breathing momentarily.
Scary.
And then they have a stroke, and there's, again, a direct link with that.
Okay, okay. One last question for
Sure.
you. Are there certain cultures or groups that might be more susceptible or more at risk for having strokes than?
Right. So they do see that the African American and Latino communities have higher risk for stroke. A lot of times when we're looking at why that is, a lot of times it's just related to that there's other conditions such as the high blood pressure and the diabetes that's correlating with that.
Robert, I understand that you threw out the first pitch at one of the games for the White Sox. Tell us about that.
Okay, well, June the 14th, there is happiness after strokes, because I was able to, and fortunate to throw out the first pitch for strikeout for strokes at White Sox Park. And I had an unbelievable time there. I didn't see the game because I had so much fun. But I heard that we won. So.
Wonderful.
There you have it.
Wonderful. Robert, you are truly, truly an inspiration. Thank you so much for sharing your story today.
Thank you for having me.
Thank you so much. Joyce, thank you once again for sharing all of your professional expertise. We thank you for everything, because it's been a wealth of information that you were able to share with us and in turn share with the Village of Hazel Crest. So thank you guys once again.